Hi guys, Dr. Arkady with ReBalance. I want to thank you for sending all these amazing questions. And in today's video, we're going to be actually discussing one of your questions. And men often ask me, Doctor, I used to be able to have sex multiple times in one night, but now I can only do it once and cannot get hard again. Why is this happening to me and how can I fix it? There are actually a few different reasons why this is happening, and they require different solutions. So in scientific terminology, the time between first and a second sexual act is called sexual refractory period. It is the recovery phase during which it is physiologically impossible for the person to have additional orgasm and therefore achieve an erection. For women, this period is very short, but for men, it all depends on your sexual function. At a young age, we have a very strong sexual function, sexual drive, and a very short refractory period. However, as we age, our sexual function becomes weaker, which is why more time for recovery is required for a second round. So if you have a weak sexual function, this is kind of your physiological characteristics. And to help you to go for a second round, I want to recommend several methods. The first method is actually not to go for a second round, but to prolong your sexual act using what we call peripheral technique. Let me explain what I mean by this. Here we have the anus and here the root of the scrotum. Now the distance between them is about 2 centimeters. It's quite dense and therefore a tendinous center here. You need to press on this point, making a perpendicular movement with 2 fingers in a sagittal plane, meaning upwards, before the point of no return. So what is the point of no return? It's when the sperm has already crossed that seminal colliculum and it's about to be ejaculated. If you feel that you're just about to ejaculate, you have to stop, or during the process, place 2 fingers comfortably between the root of the scrotum and the anus and apply vertical pressure. At this time, you may experience what's called a dry orgasm. After this, you can rest for a bit and continue a sexual act. But what can you do if you miss that chance? After an orgasm or ejaculation, avoid eating right away. Your body should focus on making more sperm and testosterone, not digesting food. Also, don't drink alcohol before or during this time. Try to breathe deeply to get more oxygen into your blood and improve your blood flow. You can also gently massage your testicles in a circular motion, but be careful, this area is very sensitive. Remember, rest is important. Your body needs time to recover, so you don't push yourself too hard. Before sexual activity, it's good to exercise regularly, both cardio and weights. Keep healthy weight and eat nutritious food. Also, please remember that good blood flow is it's essential, especially during this recovery period. Therefore, I recommend that you pay attention to some of the supplements that I personally take, and of course recommend to hundreds of my patients to support a healthy blood supply to your penis. Specifically, Citronex. You can order it on my website, on the internet. By the way, the link is in the video description. And we are continuing. In 2000, scientists from Oxford Academy conducted a very interesting study. They called it Effects of Sildenafil Administration on Seminal Parameters and Post-Ejaculation Refractory Time in a normal male. They took 20 adults, men, without erectile problems, average age approximately 32. These guys were not using any medications for at least 3 months prior to the study period and were engaged in stable relationships with a proven fertility. So some guys were giving a placebo, while other guys were giving sildenafil 100 milligrams. The scientists asked the subjects or participants to time themselves using the stopwatch, and they found something very interesting, that post-ejaculatory refractory time was about 10 minutes without taking sildenafil, whether with sildenafil, it decreased to only 2 minutes. So as you can see, this method also works, But please, if you decide to use this method, please do it only under supervision of your doctor. Do not do it on your own. Now, it can also happen that your sexual health is excellent and you really don't have any atherosclerosis of the blood vessels in your penis in particular, because you're only about 25 to 35 years old, but your refractory period slowly increases, specifically with your regular partner. Please understand me right. I am not trying to say here that your regular partner, for whatever reason, doesn't evoke emotionally arousal for a second time, but perhaps the passion that sparks that was there before has slightly changed. What can you do in this case? Here it's necessary to have an honest conversation with your partner. Perhaps there's something that just not satisfying your intimate interest. It's possible that you have some situation at home where you have small children who wake up at night, or you're feeling some inner anxiety or stress. If your home isn't an ideal intimate place, try to change things up. Taking a day off together, go somewhere new. Maybe book a hotel room or visit a spa for a relaxation getaway. Ask grandma to watch your children so you have a couple's day. These short breaks can really improve your sex life. You may be surprised to find out that you're capable of significantly more than you thought. Now, this experience may show you that you still got it and boost your confidence and your sexuality. Remember that change in scenery can sometimes make a very big difference in a relationship. Now, if all the mentioned methods really didn't help you, then you can try to just last significantly longer in bed in the first round. Watch these 8 home methods that you can use to last significantly longer in bed. Good luck with everything.